Nanda. I'm a senior cancer Ayurveda consultant and research coordinator in Sriranga Ayurveda Chikitsa Mandira, Mysore. In this Sriranga Ayurveda channel, we would like to discuss more on cancer. As we know that when the family heard or hear the name of cancer, there will be a quest for many things, like what best offered, where, how, either the alternative system is better or the concerned technology is best. So here we are trying to focus more on Ayurveda, how it helps, what are the limitations or what are the best offerings we can do to help the families as well as the patient. The first question comes usually like this, I believe. Does Ayurveda treat cancer? Or it's only a supportive therapy during chemo or radiation? Yes, we have different stages of cancer. In that, where and how it helps, we can have a discussion on that. Before that, let's see what is our perspective of cancer. Cancer in Ayurveda as an end stage of any disease which is untreated or left out treated or improperly treated will turn into a combination where it is not treatable or those diseases will act against the body. Most of our term cancer in Ayurveda will be related to Arbuda. But as per the discussions, most of the people accept that. But we believe that that is also a part of that, but it not explain everything, whatever we believe that, whatever is cancer equal to Arbuda. So there are different conditions and stages where we need to look into that. Basically, when you are looking at body as a component, it's an anabolic and catabolic activities happening there. So in Ayurveda we say that Shirete Aneniti Sharira. That means the catabolism is always happening. That's the other way. The one more way is Chiyate Annadivirti Kaya. That is anabolic. How the body is getting nutrition. So the difference between or the maintenance between anabolic and catabolic activity is the life. If there is an only anabolic or uncontrolled which is happening, that we can consider as the cancer, which almost what the modern terminologies are mimicking that. But Ayurveda, more than that, it goes like not the cell which is responsible for the cancer. Why it happened? What is the concern? Why the cell got stimulated? Why it is unable to control itself? These are the factors which we need to consider also. Usually I give an example to the patient that during the rainy season, if you just throw the seed, it will grow, and wherever you want, you see the greeneries. But in case of summer, if you try to create same environment, this will not happen, or if it happens, that is not so glorious as we see in the rainy season. Similarly, a cell will go beyond the limit or uncontrolled because of the stimulations which is getting. That is what we are treating in Ayurveda. Simply to say in Ayurveda, we say that Karya Karana Bhavas. So we look at cancer as a Karya, it's manifested because the reason may be multiple. So unless and until we nullify the cause, the causative factors are important, where cause is nullified and then the result are nullified. So let's go to the question which we discussed, that does Ayurveda treat cancer or only the supportive therapies? Yes, we have the different stages as I mentioned before. In that, if somebody has a history of family saying that the cancer is prevalent in the family, or the area where they're living very, very much of cancer, if they want, yes, we have the solutions where we try to purify the body, or we do the lifestyle changes, or recommend lifestyle changes which is required for them. In that, it's a preventive aspect. Always the prevention is better than the cure. And the second aspect of the group of patients which we get is they are already treated with surgery and chemotherapy or radiation therapy. So here, if somebody is advised for chemotherapy or radiation therapy, we treat such patient too, where it's a supportive therapy if they wish. If they want to continue the chemo or radiation, we support with whatever the requirements from our side to be done to such that the acceptance of the chemotherapy by the patient is better, or sustainability will be increased. By that, the efficacy can be multiplied. Sometimes what happens is when they get a complication, we do simple treatments where we consider chemotherapy as something Ushna Snigdha in Ayurveda. Ushnasnigdha means it's almost mimics some of the diseases like Visarpa, where we say it is like almost like an herpes. And we have treated certain cases which are responded in such a way that we can conclude that this is this one. But still, yet to see more cases where we need to come to a final conclusion. In case of similarly radiation therapy, we consider as in Ruksha Ushna, like a dry heat. There moisturing is required and cooling is also required. So in these principles, we try to treat that, or we try to help the patient to nullify the complications. Whereas if somebody who has undergone surgery and they don't want to go for chemo radiation, still we treat in Ayurveda with our own methods, but we try to use the modern instrumentation where we have the PET scan or tumor markers as a markers. There is no other option we have. Because in those olden days or the ancient days, the Vaidyas or the doctors were so capable that they were able to sense it. But we have a limitation, we need to do it. And instruments are to be used where unknown things to be made familiar or known. So there's no doubt or there should not be any complication using them. Only thing is you need to understand those things into our terms so that it becomes easy for treatments. As we know, most of us, that Ayurveda is preventive science and the curative is the second importance for the Ayurveda. If somebody is being treated with cancer, with whatever therapies he get, maybe surgery, maybe chemo, radiation, usually PET scan, what we say is a gold standard to say that there is no cancer cells in your body right now, or the active cancer cells are not there. In that condition, if somebody has a doubt that what I may get the cancer in future, for that Ayurveda has an answer. As we were discussing that, Karya Karana Bhava, cause and the effect. Only the effect is nullified by surgery or chemo and radiation. Cause will not be dealt or cause will not be cured. Sometimes what happens is, cause might be a minute which may not be identifiable through the whatever the means of tools and techniques we have, maybe radio, radiological investigations or biochemical investigations. So in that situation, it may come up once again, or it may not come up. But Ayurveda has a solution where we try to purify the body, which is called Panchakarma, where it's not only a purification, because purification, once again, say there are multiple or n number of purification therapies are available in the body now. This is a cellular detox with recalibration of the cells as well as the organs. As we know that our system, look at one unit, but it has multiple organs, maybe the lungs, liver, kidney, heart, multiple things are there. When they work synchronously, then only the health persists. If one organ is failure is there, there will be a burden on the other. It can carry, but it will not help or support 100%. Similarly, what we need to see here is, unless until the cause is nullified, the result will come up today or tomorrow. The provoking factors are too high, then the disease will manifest immediately. That means if the person is started doing his mistakes in terms of food and activity and behavior. Ayurveda always concern on these three factors because they are our life. That means they support our life, and if we are not doing it properly, that is leading to the diseases, including cancer also. So once we do the Panchakarma therapy, that will try to recalibrate. Once the system is recalibrated, the immunity or the ojas or the sattva, what we are saying to the body, will recalibrate. Once it is done, then the whole thing is left to that. Only concern is we need to be following lifestyle activities such that which can be creating an environment where the cancer cell will not grow, the immunity or the resistance in the body, what we call it in Ayurveda as Varikshamatva, or the preventive measures in the body, that will try to heal the body in a better way. We come across saying that a cell which has gone wrong will lead to the cancer. But in Ayurveda we say that why the cell has gone wrong, or what it made, or why this question will come up. It's not what happened. So in this term, if you are looking at that, we say that, or everybody knows that we are what we eat, or Siddhya Sambhava. That is what we say in Ayurveda. So the food is the main factor which plays a major role. Along with the food, the activity how you do, that is morning to evening how you keep your health, different seasons it is required, and your behaviors. These are the three factors which I already emphasized previously also. These are the things which decides to alter or to maintain the health. So the cellular changes which is happening, as the different opinions or the science is saying that the irritation which is happening or the mutation which is happening, the cell division which is uncontrolled. Of course, there are tumor suppressants or immunity cells which need to kill them. But cancer cells try to miss all those things because it has that capability. How it got that capability? Because of the lifestyle. Lifestyle includes food, activity and behavior. So apart from these things, nothing will go extra reason or cause from Ayurveda to say that what is the cause for the disease. So nowadays if you're looking at the food habits, the hybrid, the word which comes up saying that one seed will give multiple grains. That means if you have that, similar habit will be induced in us. So normally we need to produce maybe 100 cells a day. If you are eating with the food which can stimulate more than that, then the excess cells are formed. That is how we can see that. So here, the food one aspect. In that, how you eat, like I was attending a conference recently, there it was said that there is no junk food. How you prepare the food, that's how the food becomes. For example, the speaker gave an example saying that you take potato and you prepare sambar, curry, or any other preparations out of that. That's quite normal. If you try to prepare finger chips or French fries, then the whole process what you are doing is a samskara, what we say, gunantar bhava muchate. That means the samskara, the positive things what you give, that will give a positive result. The negative or the stimulating or the wrong things, if you are inducing in that, that will give the negatives. So here, so once again, food is an important thing. Just I took an example of the hybrid, but if you are going organic or if you are eating limited, that is also good. Or we say the Agni, that means your digestion is an indicator that how much to eat. If you are able to digest the stone, you can eat. There is no doubt. That means even the food, whatever the variations are happening, if your digestion is good, that has to digest whatever you are giving. This comes up with proper exercises and proper controlled meal or the diet which you are planning. Here, once again, the diet doesn't mean restriction. What best can be for you is the diet. And the other one is, as I told, lifestyle from morning to evening earlier, spending the time. So usually the time frame which we see is from the bed to the bed. So what time you wake up and what time you go to bed. In that, Ayurveda says that Brahmi Murte Uttiste. That means you need to get up in the Brahmi Murta. That is before sunrise. That's calculations are there, like 3 or 4 hours, those discussions are there. But here, that is the day starts. Where from, like in the tropical countries, at least in India, we have the 6 a.m. to 6 p.m. where the day is there and 6 p.m. to 6 a.m. the night is there. But some of the countries, if you go to the above or below the equatorial region, the time changes there. But here, this 6 hours from morning a.m. to 6 p.m., it's a day, it's an active phase. There you are not supposed to sleep. Nap is considered as something which we have after the lunch. But here, if you are sleeping after the 6 a.m. is also considered nap, where the kapha or the strength has to be formed is not helping you to produce the immunity the other way. If you are sleeping late night after 10 o'clock, the body gets heat up where you are losing or the destructions will be. When the construction is not happening properly and the destruction is more, that's what we say cancer. So repairing is not happening and maintenance is not happening. That is the failure of the whole mechanism. That means this coordination between the systems or the cell mechanism which was supposed to be respond as per the In modern terms, what we say is circadian rhythm or seasonal things which we say. That has to correspond. If that is a failure, then there the cancer happens. Similarly, the behavior changes. Somebody is getting irritated always. When they get irritated or irritations continuously, that will lead to the multiple diseases, including psychosomatic diseases. If you are worried, tensed, your digestion go ups and down. Sometimes when you fear, or if you are frightened, some people have a habit of to go to the restroom because bowel movements will reduce that. Similarly, if you are doing such an activity where the body is continuously getting strained, where your digestion is hampering, where your Agni is hampering or altered, that will lead to the improper digestion of the whatever the best food you have, whatever the rules and regulations you follow, that will not be digested or improperly digested, that will lead to the multiple diseases. So basically whatever we are looking in here is Agni. The concept of Agni is very important for us. Maintaining the Agni. We say that whenever the Agni is there, that is life. Whenever the Agni is not there, that is the death. That means Agni is the transformation or the essential things which are required to take the food or the fuel for the body to maintain and to create proper metabolism in the body. That is how the life existence will happen. So these variations in food, activity and behaviors always influences. One more thing to say about the behavior. I was attending a seminar, online seminar from Pune. One of the doctors was telling that a lady came with a breast cancer and it was treated by him. It was get cured in the sense they have seen the PET scan and the biomarkers, nothing was there. So after a few years, once again she came with the same complaint. Then they tried to identify or to take more details to saying that what might be. So initially when she had the cancer, one of her daughter was about to get married and it was taking some time. So because of that worry, this was stimulated. And the second time, the second daughter got delivered and the baby is in the house and there are some financial problems. That's how the stress started. That means stress can stimulate many things. It can alter your behavior, it can alter your metabolism, it can alter your Agni. That means a controlled, a rhythmic system is not working properly. That means that is leading to abrupt lifestyle. That is how the cancer you can see in Ayurveda.